Good afternoon, this is Dr. Do again. This video is Quarantine Special Edition, video number 9. Today's topic is on headache. Okay, probably headache is one of the most commonly seen problems in the clinics. There are different causes, from nothing, just the headaches for no reason, no organic disease, and once every couple of days, very minor or mild, to very severe, could be associated with a stroke, tumor, or any a serious problem. So before I talk to before I talk about the headache, let's briefly talk about the structure of the brain. It's one of the largest organ in the body, and skull wrapped on top of the brain tissue. Actually, and there's some connective tissue around it called the meninges. In between the skull and the brain. The interesting thing you probably do not know, is that the brain itself, very squishy, smooshy, soft tissue, doesn't have feelings of the pain. The headache, the feelings is not from the brain itself, but from the tissue, connective tissue, for example, meninges, and also in between the brain. There's some septums or some connective tissue. Those are the tissue that have rich of nerve endings, so that's the pain. We feel it. Okay. What kind of headache you need to see your emergency room? First of all, trauma, definitely. If you just fall, or you had accident, or during the sport you feel your head was bumping somewhere, definitely you think, oh, it's not serious. I observed for a couple of days. I agree. If you did not lose consciousness, you do not have any other symptoms, but just the headache, you want to observe, it's okay. But for a couple of days, so it's not getting better, you see emergency department, you see your physician. However, I do recommend any trauma to your brain, see emergency or your doctor, check it out. Okay. And the other headache you need to see your physician is if you have chronic disease, like high blood pressure. Okay, you suddenly feel throbbing headache, or it's an intolerable headache. The pain is intolerable. Especially if this kind of pain associated with neurological deficit, which means you feel numbness, your limbs cannot move, and this is definitely a sign to see emergency room. Okay, what kind of headache you need to call your physician to schedule appointment. Basically, any headaches does not go away for a couple of days or a week or 2 weeks. Better to call your physician to check out, to make sure it's nothing serious over there, because even though you're young, a lot of young people, there's special kind of brain tumor occur in young people. I'm not saying you have it, but if the headache's there for days and weeks, it's still there, then you call your physician. Okay? And what kind of headache you manage at home? After confirmed by your physician, there's nothing serious going on, it's called idiopathic headache. Okay, you can take some over-the-counter medication. Okay, so let me just briefly talk about the headache. What kind of causes for the headache? Like I said, young people does not have any medical problem, stress from work, school, lack of sleep. All of these can cause headache. Okay, and if you have the head, like I said, this kind of headache usually went away after you sleep, catch up sleeps and rest, and the causative factor like stress were removed, then you can recover, so it is okay for a couple of days. Or it's an upper respiratory infection, like a virus infection. You have the fever, the headache. After the fever is done, it going down, and your headache is gone. It is okay. But if the headache, like I said, comes and goes, no triggering factor, or you have photophobia, means the headache comes with fear of light, feel dizzy, and your eyes pain, your headache is throbbing, a dull pain for long-lasting, a week, 2 weeks, and it comes and goes, it bothers you sometimes, then you need to check out. It could be the migraine or tension headaches, or some, you have been taking medication from over the counter, and then you stop. There's a special headache called the rebound headache, medication rebound headache. So this kind of medication headaches, you need to see your physician. Make sure, check it out. There's no organic disease cause the headache. Okay, or there's another young female, obesity, and you have menstrual disorders, not regular, and headache, even hard to walk a steady gait. And this kind of headache associated may or may not have nausea, vomiting. You need to see your physician to check it out. And there's a special kind of headache I'm going to talk about today, is the glaucoma, the eye problem. A lot of times the glaucoma presentation, like chronic glaucoma, open-angled, your physician, your eye doctor will tell you, present with headache. So if you have headaches a long time ago, lasting for a long time, does not go away, that's what I mean. And you need to check out. If you have problem with your eyes, the physician will tell you, see your eye doctor. There's another special headache, like I said, associated with your hypertension, diabetes, and obesity. Okay, might impose the risk for the stroke or internal bleeding. These kind of headaches usually associated with other symptoms, like the numbness, tingling, or muscle weakness, or cannot move your limbs. So definitely the headaches, not just call your physician, but visit the emergency room. So this is the briefly introduction for the headaches. I hope it helps. However, if you have problems or concerns, either visit your emergency room or call your physician to make sure nothing serious is going on. Thank you for watching, and see you next time.